So LANAP is a surgical treatment to treat periodontal disease, but it's a very minimally invasive procedure. So traditionally, when we've treated periodontal disease, we do what's called open flap surgery, where we anesthetize the patient, we make incisions, we open up the gum tissue, we clean out the debris that's in there, we may add bone grafts and things like that to reverse the disease and to help periodontal patients. It's a great procedure, it's very predictable, and it helps patients who have periodontal disease. What's great about LANAP is we can get many of the same results using a much less invasive process. So whereas before patients experienced a scalpel and sutures, with LANAP we can anesthetize the patient, do the procedure with the laser, and many patients go home maybe taking a couple ibuprofen or Tylenol. So it's a much more comfortable process for the patient. We can treat more areas in less time, so it's more efficient for the patient. And for many of our patients, it saves them from ever having to go through any sort of traditional surgery that may be more involved with a longer recovery. Some patients who have a lot of maybe bleeding issues because they're on blood thinners, patients who have been on bisphosphonates for osteoporosis or bone cancer, a lot of those patients may not be candidates for traditional surgery. And with LANAP, because it's minimally invasive, it allows us to help those patients treat their periodontal disease. This is a tiny fiber optic point that goes in between the tooth and the gum tissue, and that laser energy strips away the diseased tissue that's lining up against the tooth. And then we can use the laser to help stimulate this tiny clot to form around the tooth. It's minimally invasive, but it really stimulates the body to heal a lot of the areas on its own.